Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
I think we have covered the schizophrenia. There are other spiritually induced disorders we will touch upon, but let's now leave mental disease aside and we'll go into medical diseases, okay? Please, if I can see video number 1 and we touch upon this case and we can understand together what we can. What is the complaint?
I have breath cyst. It comes and goes at times 3 times a day. So
you cease breathing?
yes.
And then the heart rate goes up. You feel like the heart is pounding?
Yes.
And this has been going on since how long?
Since a year now.
And you dream about what?
About having sex.
And?
Also seeing dead people.
Yes, I understand. All right. You heard the man is a young man. Does it happen to women? More likely to women. I chosen the patient to be a man because less likely it's a man, more likely it's a woman. So what is going on with this patient? He just said that his breathing ceased 3 times in a day, and yet he's right there in front of me alive. So what is going on? If your breath ceases 3 times in a day, 365 days in a year, because he has it for a year. That means, you can do the math now, it's about 1,000 times his breath has ceased on him. And he's still alive. He's breathing, he's there, he's strong. But, so is he making up the story? Why would he come to the clinic then if he's making up the story? Does he need attention? I don't think so. This is something that has been bothering him. He's been a lot of different health facilities. And no satisfaction, no, because they just didn't understand what is going on. Maybe he never gone to a specialist. If he would have gone to a specialist, the story might be different. He wouldn't be seeing me after 1 year. So what is going on? Let's understand the case together. This guy, his breath ceases. But does his breath really cease? No. It feels like, now I'm talking about the explanation. It feels like his breath is ceasing on him 3 times in a day for the last year. I asked him, do you feel your heart bounding? Yes. Bounding meaning palpitation. The heart is beating so fast. As the heart is gonna jump out of the chest. That's how they feel. That's how most of them describe when they get the attack, palpitation. Well, I tell you, this is not a medical condition. I mean, I'm talking about physical medical condition. It is not. It is physical manifestation, but not because of cardiological problem, because of a heart problem. Because we, in case we get a patient like that, yeah, more likely it's a psychiatric disorder. We call it panic attack. It's a form of anxiety, severe anxiety that manifests in the form of panic. Panic means fear, extreme fear attack, panic attack. So what is going on with this guy? We cannot just, believe him that the heart doesn't have a problem, because we've seen young people before with a heart problem causing the arrhythmia. We call it arrhythmia. When the heart beats more than usual, we call it arrhythmia. So we have to do the cardiology evaluation, the heart evaluation. So we have an ultrasound in the office. We put the ultrasound, we look at the heart. There is no arrhythmia. The atrium, which is the upper room of the heart, beats in sequence with, in synergy with the lower room, which is the ventricle. So there is no problem. So that means, because if he has a physical condition, then this physical condition will be on all the times. It's not like now I have a cardiology problem and then after 2 hours the cardiology problem goes. If there is arrhythmia, the arrhythmia is there day and night. When you wake, when you sleep, it's 24 hours. The cardiology problem is there. They don't go and come back. It doesn't work like that. So that means the correct diagnosis for this man and for anybody out there with similar problems is called panic attack, which is a form of anxiety. Treatment, some medication, SSRI, serotonin, selective serotonin reuptake inhibitors, and the doctor will decide that. You cannot decide that on your own, because the doctor has to decide on the dose and has to decide also on how many days you should be taking the medication. Plus, there is therapy, special therapy for that, and the patient will be fine. Right? So we must evaluate the heart to rule out any arrhythmia or any serious heart problem, and we continue. The most likely diagnosis in this case is panic attacks. So in summary, if you feel like this man said, your breath is seizing on you a few times in a day, you feel like your heart is gonna jump out of your chest, very bad palpitation, you feel like I'm gonna die. This is most of them how they describe the situation. I feel like I'm gonna die. I feel difficulty in breathing. I feel, you understand? And those are bad moments. Those are not to be taken lightly, because really it's horrifying. Those moments of panic attack, some of you out there who have this disorder, do you know exactly what I'm talking about? And I know exactly how you feel. Okay? This is like I said, if a dog run after you, wants to bite you, and you're right, you see, you run for your life. Take that fear that you have inside of you, multiply by 1,000 times, and this is exactly how those patients feel. Would you want to feel like that? It's very terrifying. It's very bad. So this is what we call panic attacks. Panic attacks. And panic attacks, they have a solution, they have a therapy. Most importantly, we have to understand, that this is a situation that has a solution. I am taking calls, but I think I put the phone a bit on silent, so I think I missed this call. But anyhow, if you hear me, my phone number is there. If you have a question, I will try to put the phone in front of me, so if I can take some calls if you have a question out there. So we have discussed panic attacks. It's a form of anxiety, and we have discussed how the patient feels. And if you have someone, if you are yourself feeling the same way, so please, this is what you have, panic attacks. You should check yourself into the nearest specialist to get the heart evaluated correct and rule out any serious problem with the heart. Then if it's not the heart problem, is no arrhythmia, is no heart rate that is because of pathological reasons, then most likely it is a panic attack, and that's exactly how they come in, and this is exactly how they describe themselves. Now, I said the last time that it's very important to recognize the early signs and symptoms of any disease to get a better prognosis, to get a favorable prognosis, to get a favorable outcome so you can recover faster. So early recognition of a disease is crucial for early prognosis and early recovery, right? I'm going to show you now another case. Let's see it together and then we'll talk about it. Let's see the next video, please.
Of Mama, what is your complaint?
My stomach is large, and this place I'm feeling pains here.
Yeah, biting pains here.
Biting pains here on top of my navel.
Right.
And I was operated there.
Yeah.
This oblique and
It doesn't matter. Okay,
Yes.
when was the operation?
Last year, 2001, June.
Okay, no problem. And you said 2 of your kids are hepatitis B positive?
Yes.
Okay, Mama. So, and you never tested hepatitis yourself before?
No.
All right, so now we're gonna do an ultrasound to see what is there, okay? All right, now, looking at the ultrasound here, this is one side of the liver, okay? This is hepatomegaly for sure. But if we look closer into the liver, we see nodules all over the place. This is the left side of the liver, nodular. This is the IVC. If we put some colors, if you want to see the colors, this is the IVC right there, and this is the right atrium, the one that is beating in front of you. So now we're gonna move on. We can see a lot of nodules here. We see the liver all big, all the sinusoids are all enlarged. And now this is the right kidney here. The right kidney looks okay to me. The right kidney looks okay to me. But when we look closer to the liver, we see nodules. We see nodules.
Yeah. Let me talk about it. Play the next one also. Play the next video so we can look at the spleen as well, and then we'll summarize the whole case and we'll talk about it. This, please, if you don't mind, I appreciate it if you can play the next video as well, please.
We're looking at the heart for the same patient. The heart is okay. There is no pericardial effusion around. There's no pericardial effusion. The left ventricle function, just by looking at it, we don't have a problem. We're looking at the different valves. I don't see a problem here. We don't need to take any measurement, just from experience. The way the heart is beating, I can say the ejection fraction is within normal, and the left ventricular function is within normal. We don't need to waste time on that. But look at this here. Look, the abdomen is full. This is nodules all over the liver. The liver is huge. It's filling up the stomach. And the bites, we can understand now where the bites are coming from. This is over distension. It's not because of adhesion, because of the previous surgery, that's for sure. But this is a metastatic cancer. Okay, if we look at the gallbladder here, the gallbladder, we see a small stone, but this is irrelevant. This is not the problem. You see the small stone inside the gallbladder. This is irrelevant. This is all nodular liver, huge nodular liver, most likely metastatic cancer. Next step for this patient, to define the primary, we send her for CT scan.
All right. Well, there is another one, but it's okay. We're not going to play it. It's okay. We also looked at the spleen, and the spleen is full of nodules, and that was the key. That we know when the situation like this is, unfortunately, after I told the patient, listen, we send you for CT scan because we know this is most likely it's cancer, and we know what kind of cancer it is, but we need to see CT scan to look for the primary. Primary meaning where it has originated from, the mass. But, oh, doctor, I made a CT scan. When did you make a CT scan? Oh, back in January. Oh, wonderful. Why you didn't tell me from the beginning? Oh, maybe she was testing me. Anyhow, so what I told her is exactly what the CT scan have said. It is cancer. And it is lymphoma. Okay, lymphoma of two kinds. There is Hodgkin, there is non-Hodgkin. What she has is a classical Hodgkin lymphoma, which is a good kind. The other one is very aggressive. You don't want to have it. But why I'm giving you this case today? I mean, this is a case because I want to tell you this could have been all prevented easily if the patient have just listened to a second opinion. Why I'm saying that? How could it be just prevented? A case like that? Come on. Yes, it could be easily prevented. When I took the history from this patient, she told me the following, that she was sick and tired for years from internal heat, night sweats, and a bit of loss of weight. Three things. Internal heat, those people from, they not very highly educated, and they tell you in their language that, in common street language, that internal heat and fever. And I'm losing that, I'm thinking I'm losing a bit of weight. That definitely, out here in Cameroon and Africa, malaria, typhoid, malaria, that's what it is. So she went, malaria, typhoid, malaria, she doesn't get well. She take the treatment, she eat the medicine, she doesn't get well. The same thing, the internal heat, the high fever above 38, and a bit of weight loss. She doesn't get well. So this is what we call now unexplained fever, weight loss, and night sweats. This is what we call those three things. Unexplained, meaning malaria did not explain it because she took the treatment for the malaria and she still gets it. She took the treatment for typhoid and she still gets it. That's what we call what? Unexplained.